Hi friends, welcome to Diagnox. Today we are going to discuss an interesting topic, that is silolith. We all are aware of renal stones. Similarly, stones can occur in salivary glands. So today I will be showing you a cone beam CT findings of a patient with a stone in the right submandibular gland. Before we go into it, we would see how to avoid salivary gland stone formation. There is one important thing that can be done to avoid salivary gland stone formation, that's staying adequately hydrated. Drink adequate amount of water. We all know that xerostomia is one important cause for salivary gland stone formation. So drinking adequate amount of water can prevent salivary gland stone formation, and there is no relationship between salivary gland stone and renal stones. So one easy way to identify salivary gland stone clinically would be patient would experience pain and swelling in the respective salivary gland just before the patient have food. So imagine a patient is having food, the salivary gland starts secreting saliva, and this saliva would rush into the oral cavity through its duct. When there is a blockage in the duct in the form of stone, the saliva cannot come out. The gland would start enlarging, which would result in pain. So there are two important salivary glands. One is the parotid, which are the paired glands which is present below the ear. Two, the submandibular gland, which are again paired, which is present below the angle of jaw. Submandibular gland tend to produce salivary gland stones more often. They are more commonly involved with salivary gland stone formation because of its independent position. Its position is downward with respect to its duct, which is positioned superiorly. Its duct has got a wavy course, and of course the secretion of submandibular saliva itself makes it more prone for salivary gland stone formation. So I would tell you what is the easiest way to diagnose a salivary gland stone. So when you suspect a patient is having a salivary gland stone, the first important imaging modality would be to take an orthopantomogram. Orthopantomogram helps us rule out the dental cause, which may also mimic a submandibular gland swelling, because any space infection from the mandibular molar teeth can mimic submandibular gland infection. So first thing, rule out dental issues with the help of an orthopantomogram, and orthopantomogram can also give, or OPG can also give some information regarding large stones. This is an orthopantomogram of a patient with a swelling in the right submandibular gland region, and we have taken a OPG just to rule out gross carious issue and to see whether there is any calculi, and of course you can see a radio opaque calculi or stone in the right submandibular gland region, and we see another radio opacity which is of larger in size, which is being overlapped by the body of mandible. This is again one more large silolith which is related to the submandibular gland duct. So the next easiest radiograph to confirm the stone in the duct would be to take an occlusal radiograph, which is a radiograph taken at right angles to the OPG, and we can confirm the presence of a large silolith here. And of course we can take cone beam CT, we can take CT to diagnose salivary gland stones. But there are some salivary gland stones which are not calcified, which makes the clinical diagnosis very challenging, and for those conditions we may have to go for a silography, and these stones must be surgically removed, and stones within the gland causing clinical symptoms, the gland should also be removed. And this is the picture, surgical picture showing the submandibular silolith. This is such a huge silolith. It measures about 4 centimeter in diameter, and this is surgically removed and the patient is absolutely fine now. And you may see silolith in a similar fashion in the oral cavity. This is a slightly smaller silolith which is related to the duct of the right submandibular gland, and again these can be removed with ease. So now I would show you a cone beam CT finding of a patient with a right submandibular gland as silolith. This is the panoramic reconstructed slide. So this patient complained of swelling and pain in the right submandibular gland region before she have food. So we can appreciate a radio opacity which is being overlapped by the body of right mandible. So we would move on to the other slices to confirm whether this is a bony lesion or this is a silolith which is related to the right submandibular gland. As usual, we will move on to the MPR slices. We will go on to the axial slice. This is related to the lower border of mandible. We would just move inferior as well as superior in relation to this axial slice. As we move superiorly, we can appreciate a radio opacity on the inner aspect of ramus of mandible. We would focus on this particular area. We would appreciate this area. We would appreciate this area in other slices. You can clearly visualize that there is a silolith in the right submandibular gland region, probably in relation to the deep lobe of right submandibular gland region, and the center of the silolith is not calcified, so you are seeing a radiolucency. We would appreciate this thing in 3D aspect. You can see that the silolith being present in relation to the right submandibular gland region. You see a lot of artifacts which is related to the metal braces, and that's it regarding this particular case. So stay tuned to Diagnox to see many more interesting cases on salivary glands, on TMJ, on cone beam CT scans, on implants, etc. If you have not subscribed to our YouTube channel, kindly subscribe it. Thank you.